Hey NP2, what I wanted to do is start you on the digestive system for this class that I had to miss. So I wanted to catch you up with the other ANP2 class. So what I need you to do is follow along and take notes. This is based on the lecture itself. So pretend like you're in class right now and make sure you get this. We're going to talk about the digestive system. This is the one that converts food into essential nutrients, and it's absorbed for the body, and anything that's unwanted will be put together as waste. So there are phases to digestion. The first one is ingesting food, which means just taking in food. The next is movement of food. That's also called propulsion. That's either swallowing or something called peristalsis, which I'll discuss shortly. Then we have mechanical digestion of food. That means physically chewing food in the mouth, churning food in the stomach, or mixing by segmentation in your intestines. So all three of those things are going to be considered mechanical digestion. Chemical digestion is strictly done via enzymes, which you saw in the lab you just did this past week. The next one is absorption. That's transport of digestive end products into the blood or lymphatic system from the intestines. Mostly we're talking about the small intestine on that one. And the last one is elimination. That's undigestible material that is taken from the body and leaves your body via feces. Okay? So there is a slide on your PowerPoint that kind of puts it all together for a visual. Make sure you know those different phases. You have to know them, of course, and where they occur. Again, mechanical digestion, make sure you know it's chewing, tearing, grinding. That all occurs in the mouth with the teeth and saliva and tongue, and make sure you know that mashing and churning is in the stomach intestines. It's not just mostly done in the stomach. The intestines have a vital role in that. The enzymes really work on substances that are very difficult to digest. Those are going to be carbs, proteins, and lipids. Those are the things we did in your lab. The tract itself, from mouth to anus, is the GI tract, better known as the gastrointestinal tract, or a very muscular alimentary canal. It's open on both ends. The tube runs through the ventral portion of your body. You have your mouth, pharynx, esophagus, stomach, small intestine, large intestine, and anus. You have those organs that are the major contributors to that tract, but you also have some accessory organs that help digestion occur. Those accessory digestive organs include teeth, tongue, salivary glands, liver, gallbladder, and pancreas produce the enzymes that we talked about. Some definitions you should know: peritoneum is serous membranes found in the abdominal pelvic cavity. Of course, you have a visceral and parietal. You know that the visceral touches the organs like saran wrap, and then the parietal will line the body cavity. In between the two, you're going to have the serous fluid. Remember, we need serous fluid to prevent friction. Very violent motions through these organs, especially during digestion. The peritoneal cavity is a specific location. It is that location where the serous fluid is found between the parietal and visceral peritoneum. Okay, I'm going to remove. Okay, so you have some new definitions, of course. The first one is mesentery. Mesentery is a double-layer membrane of peritoneum that supports most of the organs of the abdominal cavity. It has the majority of fat storage for protection and nutrients if necessary, and it allows circulatory vessels and nerves to actually reach the organ. So it travels through that mesentery to the organs itself. You have ventral mesentery, of course it's double layered. It runs from the stomach and liver to the anterior abdominal wall. You have a lesser omentum, double layered yet again. That is from the liver to the stomach and duodenum. And you have the greater omentum that connects the stomach and posterior abdominal wall. Again, you're noticing I'm making you memorize these mesenteries because they're holding the organs in place. They're keeping them so they're not in high motion. The last one is the falciform ligament. If you notice on the slide, ligament is in quotes. It's in quotes because it's not a true ligament. It really is mesentery, and that binds the liver to the anterior abdominal wall and diaphragm. Again, it's there for non-movement, and if you can remember looking at the models in the lab, that really large liver, that white line was the falciform ligament. It's fairly large. You're blessed because when we divide the abdomen, we divide it into 4 sections: right upper, right lower, left lower. The only thing is I want you to know what organs are found in those locations. If I ask you a specific question regarding that, I want the majority of the organ is found where. Like the stomach, the majority of the stomach is found in the left upper quadrant. Okay? Okay. Of course, there's layers of tissues, so the histology of the alimentary canal is the same from top to bottom. It doesn't change. There are 4 layers from the innermost to outermost layer. The innermost layer is called the mucosa. The layer that surrounds the mucosa is called the submucosa. The layer that surrounds the submucosa is called muscularis externa. That's the muscular layer that helps within the peristalsis motion. And the outermost layer is serosa. Serosa is going to be aiding producing fluid for motion. Okay? So let's start with the digestive process and begin talking about each specific structure found in the digestive system. We will start with the mouth. Okay? It begins digestion, surrounded by lips, cheeks, hard and soft palate, and uvula. Okay? There is a vestibule in the oral canal, just like there is one in the nasal canal. The oral canal is the space between the lips and cheeks. I always say that's where you stick dip. Okay? Oral cavity proper is the actual area where the teeth are found, and your lips and tongue are held together by something called a frenulum. Frenulum is a mucosa fold. And of course, there can be lots of diseases and disorders associated with that if it's not placed in the correct position, such as if it's not positioned on the correct place on your tongue, you can have speech impediments. Okay? Your tongue is mostly made of muscle, covered with taste buds all over it. The lingual tonsils are found to the back of your tongue. Its main purpose is to grip food, flip it, reposition it, and make sure it makes this oblong shape called a bolus. Bolus is necessary for swallowing. Okay? Within those taste buds are little circles, and they're called papilla. Each papilla has a single hair in it. That is for identification purposes. So if you eat something salty, one spot of your tongue is that hair almost vibrates, and the hair sends a signal to your brain telling you, hey, that's salty, and you recognize it with, I don't know, peanuts. Okay? Your teeth are also called dentition, hence the name dentist. They grow in sockets. They should have a constant supply of blood and nerves. There are 2 types of teeth. Specifically, you have your primary or deciduous. They're baby teeth, but don't call them that. Either primary or deciduous is the correct terminology. You roughly get about 20 of them. The book says 6 months, but I've seen children that are born with a tooth. So That's not really important to memorize when you get them. They're supposed to fall out between 2 and 8 years of age, but again, my kids are 11. They haven't lost all their teeth. Teeth also come in a permanent set. You're supposed to get about 32. All but the third set of molars should be in your mouth by adolescence. That third set of molars is called wisdom teeth, and you don't necessarily get all 4 of your wisdom teeth. You may just get 1 or 2 or none. Okay? There is a term called impacted. Impacted teeth means that the teeth are not in sockets, they're actually growing into the bone bed, so growing into the maxilla or mandibula. That's a problem. That means it's not getting the correct blood supply or nerve supply, so the dentist is going to have to intervene. Of course, there's classifications of teeth, You've learned that in the lab. You have your incisors, which are in front. Those are for chopping, hence rabbits have those because of the type of food they eat. Canines are used to tear. Dogs, you can think about it. Premolars and molars, those are for grinding. Again, we eat all types of food, so we don't have any real dominant teeth in our mouth. Again, they are accessory digestive organs. We do talk about in class a disease or disorder, a tooth abscess. It's a collection of infected material pus in an area. It could be in the tooth itself, in the center of the tooth growing, or it can be in the gum line as well. If it's in the tooth, it come from tooth decay or trauma. Any of those things can allow bacteria that normal and natural in your mouth to penetrate into your center of your tooth. Remember, enamel becomes porous, so any of those holes, an opportunistic infection can occur. It's dangerous in the center of the tooth because it can go into your bloodstream and travel to your brain. So that whole idea that infections in your mouth are one of the most dangerous is very true. If you happen to have it in your gum line, the worst thing to do is pop it or break it because you're going to swallow. If you swallow, it then has an opportunity to travel throughout your body and cause problems. What do? Antibiotics. Usually it's a very strong antibiotic. It can be a root canal, it can be an extraction. It kind of depends how long you've had it. Salivary glands. There are 2 types of salivary glands. There are the intrinsic salivary glands that's found within the mucosa. They secrete saliva at all times to try to keep your mouth moist. Moisture is there for many reasons: to prevent bad breath, to keep your mouth healthy, and to aid when trying to swallow. Extrinsic salivary glands, there are 3 pairs that are outside the oral cavity. Remember seeing them on the models in the lab? Their ducts lead to the inside of your mouth, and they secrete saliva right before or during eating. You know, when you see something on the screen or on the TV that you're like, oh, that looks good, and right away your mouth starts watering, that's extrinsic. Okay? So what is in saliva? Water, ions, lots of mucus, enzymes. The enzyme is called amylase. The amylase is specific to digesting carbohydrates. Remember, I told you that potatoes are one of the most difficult things to digest? Well, here is proof of it, that an enzyme has to start digestion in your mouth to make it fully digest. There's also antibacterial and antiviral agents found in your saliva. Again, all the stuff in your saliva is to keep pH at a normal level, keep bacteria dead, moisten food, and begin the digestion of starch. Okay. Again, mouth breaks down food mechanically, moistens food with salivary glands, which is an accessory structure, begin digestion of starch, kills germs, and forms a bolus. Okay. So amylase is for the starch, mucin is going to make the mucus, There's buffers in there for the pH, yada yada. Okay? The next structure I want to talk about is the pharynx. So the bolus of the mouth is formed, it's pushed by the tongue, and it goes into the oral pharynx, then the laryngeal pharynx. To move into the esophagus, your body uses 3 constrictor muscles, of course you have to be familiar with. They're all skeletal and they're all voluntary. You cause the motion. So if you look on the left-hand side of the slide, I starred the constrictor muscles. You have superior, middle, and inferior pharyngeal constrictor muscles. Obviously, superior is on the top, middle is in the middle, and inferior is on the bottom. They move one at a time, pushing that bolus down. The esophagus is also called the gullet. It is from pharynx to stomach through the diaphragm. Food passes by peristalsis. Peristalsis motion is where if you had a sausage, one would squeeze, that causes the food to move a little bit. This relaxes, then this next area constricts. Food moves a little bit more, this relaxes, moves, and this one constricts. That's peristalsis. It's not a long, everything constricts and it goes. It's segment by segment motion. It always goes in one motion unless you're throwing up, but it's basically one directional, unidirectional. Again, the 4 layers of tissue are there: mucosa, submucosa, muscularis externa, and then lastly serosa. The esophagus comes to an end when passing through the esophageal hiatus and entering the stomach. There is a sphincter there. Again, once things has entered the stomach, you don't want it to go back up. That causes some serious pH problems with the acidity from your stomach. So there is a sphincter right where the esophagus and stomach meet, and it closes immediately when stuff has entered into your stomach. Okay? And there's a disease or disorder for this last portion of the class. It's called peritonitis. That's inflammation of peritoneum. That is the thin tissue that covers most of your abdominal organs. It can cause a major infection. You're going to feel fever, fluid gain in your abdominal area, constipation, fatigue, nausea. Literally, you're going to get, if bacteria grows in the stomach, it gives off gas. And if it gives off gas, that stomach is going to distend. And one of the things doctors do to see if you have this is they thump you, like literally thumping a watermelon. And doing that, they can hear that it's gas in there and it's not truly solid. So that's an indicator that there is a high level of bacteria in that area. So they're going to give you very broad spectrum antibiotics, high dose through an IV to make it stop, because obviously it could spread all over your body. Okay, this is where I want you to end up, so you're at the same area as the other class. I do want digestive system to be completely read. I will offer maybe a small quiz the next time I see you to ensure that you've done this work. So it's based on this lecture alone. So be prepared for that. Also, this coming week is your practical. Be prepared for that as well. Okay, so now you are officially caught up with the other A&P2 class. Yay! Okay, good luck studying. See you